Probably the main risk factors that I see in the operating room is a patient will come in, and let's give you a typical case. We had a case today of a young guy that was in his 40s. It used to be he would be skinny on the table. Of course, now he's very heavy. The guy probably certainly looked like Santa Claus laying flat, and he was a pregnant male, so to speak. I think it's telling us that what risk factors does this man have? The most important risk factor is simply an eyeball test. And the eyeball test is you look at them and they're way overweight. Your body wasn't meant to keep all that weight. Now, I can give you lab tests, but they won't tell you what's going to happen to you right then. The lab test is just simply a measurement of what circulates through your body. What you are asking me for, though, is, will I have a heart attack? No one can tell you that. I can tell you the odds are that you're high risk, but I can look at you and tell you that. The most important thing of this entire thing and message to get across to you is you need to take care of yourself. You can do more to prevent atherosclerotic problems in your body and treat your diabetes than I can with pills and certainly with surgery. So you have to be the major player here. I can represent about 5% of the benefit. That's all. The other 85 or 90% actually is going to come from you. If I fix your heart up, but you continue the same way, it won't be long, you'll be back. And you'll want another stent, or you'll want something else fixed. If you want to not come back, or not even get there to start with, you need to start and you need to buy into the program that this is my body and I've got to take care of it. Because no drug will take care as well as you will with your diet and with your exercise. Now, I know many of you know there's genetics linked to diabetes. But I don't know many of you that can pick your parents. The genetics is big. If mom and dad have diabetes, unfortunately, you will probably get diabetes. That means that if you don't have it yet, that's what's coming. Diabetes is not a friendly disease like, I guess, smoking in some respects. Smoking is not friendly either. But diabetes affects many parts of your body. It makes it so you can't see. It means that your kidneys aren't going to work, and most people on the kidney machine have diabetes. It means that actually over time your liver will not function as well. You'll notice that if you haven't looked at your toes lately, see if you got hair on your toes. Why would I ask you that? It's because we do not take people to the cath lab until we look at the hair on their toes and check their pulses in their legs. Because most people that are real heavy don't walk fast. That's because you are so heavy you can't get up enough speed. The blood supply that goes to your feet also feeds the rest of your body. If you have plugged up arteries from creamy-like serum throughout your body from, again, not taking care of yourself well, you will also plug up the small capillaries in your toes that actually make hair grow. So you have severe atherosclerosis, and many times I need to know that before I start the case, because I might stick you in the leg to do a heart cath, but I can't get in that leg because it's already closed. And I may have to go to the other leg. Now, it used to be 20 years ago, I could always get in from one side or the other. But now we do radials because we can't get in either groin, and the arms are the only way in. So times have changed. This disease is the worst I have ever seen as a pandemic. Smoking was tough. This was not the same kind of disease. It doesn't hit you right off. It hits you from the time you're young, and you never have quality of life after that. It's always a little bit more downhill. We don't want that. We want you to be happy and live well. So if you have family members that have problems, get with them and try to get them onto the right diets and try to get them into areas of blood pressure treatment for risk factors. What would I look for? High blood pressure certainly goes along with it. High cholesterol, but especially high triglycerides and low HDL. Most people say, well, my LDL cholesterol, which is one that's bad, is not really elevated, so why do I need to take some drugs to lower my cholesterol? It's because there's other types of lipoproteins or fat in your blood that is even more atherogenic than LDL. And you know who has that? Diabetes patients. It's the worst you can get. They have no good cholesterol and they have lots of bad cholesterol that circulates. So it's very important that your diet is under control and that you exercise.